Hi, everyone, and welcome to our first episode of Partner Perspectives, where we connect with our partners to share insights on evolving screening trends and highlight how we're working together to help organizations solve today's challenges. My name is Angie DeRitis with Asurint, and I'll be moderating today's chat. Joining me today are Amy Andersen and Nicole Berryman from Verisys and Tom Manning from Asurint. So thank you all for being here. For today's episode, we are going to dive into the current state of healthcare hiring, the rise of identity fraud and bad actors, and really how organizations are navigating these challenges. We'll also talk about how Assurant and Verisys are partnering together to help mitigate risk through a more comprehensive approach to provider screening and monitoring. So before I get started, just real quick, I think it would be great if each of you just gave a quick introduction of who you are and what you do. So I'll go ahead and start with who I see on my screen first, which is Nicole.
Hi, my name is Nicole Berryman. I am our Chief Commercial Officer over at Verisys. A little bit about the organization is we have two different sides of the business. We are one of the largest credentialing organizations. We also do data and monitoring, and we've been in business for over 30 years.
Great, thank you. Let's go to Amy.
Hi, everybody. I'm Amy Andersen, and I'm the president of Verisys. Nothing I need to add on top of what Nicole shared.
And we will conclude with Tom.
Yes, hi everyone. Tom Manning. I'm the Vice President of Product at Asurint, and we've been in business of doing background screening for over 20 years, both in the healthcare and broadly throughout the market.
Great. So let's start just pretty much setting the stage of kind of what we're seeing across the healthcare landscape today. Identity fraud. That's been becoming a growing concern, especially in healthcare. So Tom, I'm going to start with you, and Amy and Nicole, just feel free to chime in, but can you just share how widespread this issue is today and why it's so difficult to detect?
Yeah, so I think it really starts off with the knowledge. So what do I need to do in order to commit, fraud, waste, and abuse on the healthcare side? And a lot of it comes down to the knowledge of what does it take to do that and get away with it. And so what we've seen a lot is that first and foremost, most of the programs that are trying to prevent this are heavily focused on the jurisdiction of where they're providing that service. So for most of these, it's at the state level. So they're just looking for, on the criminal side, what is happening in the state that we are providing that service in. And from a knowledge perspective, this is because they're not searching for criminal records, as an example, outside of their state. Individuals are doing a lot of state hopping, committing a crime in state one, moving to state two, and starting a business or providing care in that state, and hoping that the provider organization is not looking at other states or their history of crimes that they have committed. So the ability to know, as long as I just continue state hopping every 1, 2, or 3 years, what I did in the past won't be made available to the program that I'm supporting. And I know, Amy, right on your side, you're seeing that quite a bit on the license and the credentialing component.
Yeah, absolutely. So we see this mirrored in provider credentials almost identically. And so what a provider will look for is opportunities to not just practice in new states. For instance, if they lose their license in one state, we do see state hopping. State hopping is not necessarily a new concept in healthcare fraud, waste, and abuse. But what we have seen is as there has been an increase in the ability to deliver care and the modes to deliver care, like telehealth, and there's more virtual platforms now to deliver care. We're seeing more and more opportunities to reach patients, and this is positive for the most part. And we're seeing, technology kind of pulling healthcare forward and making access to care more available to patients. But at the same time, it has opened up this space where some of the underlying assumptions that organizations have put in place historically around screening providers, credentialing providers, their practices are not meeting that expansion appropriately. So as technology grows, so does fraud, and so does the opportunity for fraud. And so, for example, if you're looking at just a basic use case of telehealth, right? Historically, a health system might credential a provider in the state where their health systems are located. But now, with telehealth being so pervasive, they have to credential a provider in every state where that provider can practice. And because they're trying to deliver care in more states, an appropriate credential review, much like the background screening space, involves looking at spaces outside of where that person is trying to work today, looking at their historical behaviors around licensure. Have they been moving states? Have they had adverse actions in other states? And so the crossover of the criminal data with licensure data, it's compelling. We see the same trends on both sides, and the combination of that data makes us an even more clear picture of what the landscape around fraud, waste, and abuse looks like right now.
Yeah, and to add a little bit to what Tom was talking about from a background screening perspective and what Amy was sharing with a credentialing perspective, I'm going to back it up a little further. So, and this is something that's not just isolated to one market. It's not just the payer market. It's not just a provider market. It's not just a pharmacy market. It's very widespread. And if you back it up even further, this starts if you're in human resources and talent acquisition from a recruitment standpoint. So you're talking about when you're going to source applicants, when somebody does a job interview, when you make them an offer and then they onboard as an employee. There's a lot of different places that it can fail throughout that process before that person is even onboarded, before they have a background check, before they go through a credentialing process.
It sounds like just, the complexity and how sophisticated these actors are really a big part of that challenge. So thank you all for addressing those. I'm going to turn to Amy, I think, for this question. And you addressed it a little bit earlier, but in terms of just common gaps in healthcare screening and monitoring, how are bad actors exploiting this today?
Yeah, it's a great question, and I will focus in maybe a little less on the broad perspective around fraud, waste, and abuse and identity management. I'm going to narrow in on a couple of very specific areas where we see breakdowns in healthcare screening specifically. And there are a lot of underlying gaps in the processes supporting screening in this space that are taken advantage of. So I will start with provider licensure because it's a good core use case here. But there are assumptions around how healthcare providers work. And a good example of this is when most patients are looking for care, they are not doing like credential review on their healthcare providers, right? Typically, they're going on social media and saying, "Hey, I'm looking for a good pediatrician. Does anyone recommend somebody?" Right? We spend more time, shopping for a refrigerator than we do for a healthcare practitioner, and that's actually that's not negative. It's because we think about the healthcare space as safe, right? There's these associations of and assumptions around healthcare providers that these people are qualified and educated and prepared and safe for me to engage with as a patient. And those assumptions we find regularly, much like in the background screening industry, that is incorrect, right? There are gaps there. And so individuals or bad actors that are trying to exploit the system, they're going to look at organizations that are following outdated processes, and that's where they're going to get employed, get contracted, et cetera. It's not that we have all of these hospitals, health systems, pharmacies with bad processes. What we have is these organizations with disparate processes. And because they're totally separate, there's an opportunity to take advantage of those separate processes. So I'm going to use the example of criminal background screening and licensure. And that's one of the things we've talked about a lot with Asurint in recent months and years. But this is a perfect example of where fraud can exist and where an organization could be taken advantage of by a bad actor. So if a provider gets hired, they get hired by an organization that checks their license. Maybe they're getting hired in the state of Tennessee. They have an active license in the state of Tennessee. So from a regulatory perspective, they can practice in that state. We would know, right, looking at them more holistically, that they've lost their license in 3 other states, but they can actually practice in Tennessee. And then in a totally separate part of their onboarding experience, they have a background screening event, right? And they do a criminal background check, and the criminal background check searches, because this organization is kind of following a standard, but a somewhat outdated standard of practice, they are screening just the counties where, near where that person is working, but they're missing the criminal behavior from the other states where they also have lost their license, right? So this person gets onboarded, they're treating patients, they're introducing risk to that patient every single day, to that organization every single day, but they followed all of the right processes. They did complete a criminal background check. They did complete a credentialing event that meets typical standards. And so I think that is the underlying issue here. And we see this type of issue all day, every day, right? It's not that these organizations are being negligent. It's that their processes have not evolved as quickly as the opportunities for fraud.
Nicole, Tom, do you have anything additional to add?
Yeah, when Amy was talking about that use case, it reminds me of something that was in the news last year. It was for Shannon Nicole Womack, and she was a healthcare provider. And what happened is it kind of talks about all the different gaps that you can exploit. And in this case, Shannon Nicole Womack was a healthcare provider, and she would change her name every time that she went to an employer. So if you don't have that ID verification or you're not looking for aliases, that could be a gap that gets exploited. But not only was she jumping from changing her names, she was jumping from state to state. Every time that she had something wrong or committed a crime at one position, she would get fired, and then she would go to another state and get another job and go to another state and another job. So she would change her name, change states, and she stole identities to where she was using active licenses, but somebody else's licenses, and she wasn't being monitored ongoing. So there's a whole bunch of gaps within that case that shows what can be exploited.
And one thing I would add to bring both what Verisys is providing and Asurint together of why, again, joint solutions that are doing comprehensive criminal and on the licensure credentialing side is that Amy shared about people are actually providing care, which is great, outside of the state where they're currently active and through their prior address history. So that even what is considered to be a comprehensive criminal background check, you're looking at not only where they currently live or where they previously lived, but individuals are absolutely committing crimes outside of where they have lived. And so that's where understanding where have they practiced, where they have license or where they've had sanctions, combining that with criminal check to identify associated criminal records from those locations that would not have shown up in their address history is a really important piece. We found a huge connection between those two pieces. They never lived in Ohio, but they actually did have a license to practice in Ohio. So let's make sure we're having criminal coverage in Ohio to justify that. So there's a lot of using both components together can really bring about a much more holistic and accurate picture of a provider.
Absolutely. I think it just shows how, fragmented this system can be and how it's easy for someone to really slip through the cracks. I laugh at the example you made, Amy, regarding finding a provider versus a fridge, because this weekend I spent looking for a new fridge, and you made me think of how much time I actually spent reviewing all these different refrigerators at Home Depot. And when I look for a provider, really, I try to find who's available the fastest. It's just so hard to find someone nowadays. So that was a very relatable example you called out. But now let's talk about healthcare fraud. So kind of looking ahead, what trends in healthcare fraud, should organizations be preparing for? I will go to Amy again.
Sure. So I would say in the near term, definitely, I would say the continued trend of not just state hopping, but I would say from a process perspective, right? There will be a continual push and need to look across all 50 states. That is not going anywhere. That is going to become even more critical as we see more and more provider types having the ability to practice in multiple states. And there are compact licenses that allow providers to practice in multiple states, right? And we're seeing this happen more and more. Another component that I think gets missed here and where we see this moving from a fraud perspective is movement between professions as well. And we have seen a rise in this over the past couple of years, especially. And what I mean by that is you could, as a physician, lose your license for malfeasance of some kind, but you're qualified, you went to medical school, you could go sit for a pharmacy board. You're a pharmacist, right? So looking not just across states or in a single profession and kind of narrowing your scope, but you're just broadening your scope to how has this individual worked across their full career? What does their full career look like? Where have they lived and worked? Where are they licensed? And when I say lived and worked, I don't mean physically. I mean, where have they provided care? An example of this that I mean, it's anecdotal, but I'm going to share it anyways, is GLP-1s, right? GLP-1s is a trend that everyone is hearing everything about, right? Like it's on the news, it's everywhere. And access to GLP-1s has increased, as has the ability for fraudulent providers to access patients. So they can go on social media and say, hey, we sell GLP-1s for $50 a month, right? And, everyone just assumes like, oh, well, they're everywhere. So I can get access to this. Someone will mail me something. I'm paying $50, but they're not like checking the provider, right? I was joking. A friend of mine recently was saying she got GLP-1s and all of her neighbors got GLP-1s from this person they call Ozempic Tracy in their phone. Like that's crazy, right? That's crazy. And it's crazy to us because, there's no screening there. There's just an assumption. Well, someone else got it in the mail, so it must be Ozempic. It must be a licensed provider. And this isn't a unique story, right? It's all over the place. And I don't think that it's going to be limited to just GLP-1s. I think as care continues to become more accessible through technology, I think that there will be more opportunities like this for fraudulent providers to get more direct access to patients. And so from a screening perspective, looking at ways to more broadly screen a provider and employees as well, right? I think just anyone who's interacting with the healthcare system, I think, there's just so many opportunities to now engage with patients differently. And so looking at the criminal background component more holistically, looking at identity verification more holistically. The example Nicole shared earlier of an individual using someone else's credentials. That is very common. We see it every day in what we do. And so I think just really sharpening that, not just, a provider has all these credentials on paper, they're verified, but is Dr. Jane Smith the same Jane Smith, right? That is working for your hospital. I think that is really going to continue to get a lot of attention in this space.
Yeah, and to go back, you think about it, COVID happened. Once COVID happened, it really limited the amount of offices that you could go into, the access to care. So what happened is in the mental health, behavioral health, telehealth spaces, everybody had to have licenses. They wanted to practice in all the 50 states. We wanted to make care more accessible because COVID closed a lot of things down. So thinking about that, if you're in a whole bunch of neighboring states and you have, say, an on-call person that does telehealth because they go into an emergency room after hours, or say like you don't have the funds to be able to go into an emergency room, and you're like, hey, I looked at the back of my insurance card and I can do telehealth and it's not that much of my deductible. I want access to that. How are we screening these mental health, telehealth, behavior health? Are we checking all of the states that they lived in or that they could potentially work in, to go along with what Amy said?
Then I would say on the criminal side, there's two things that we're seeing. First relates to federal crimes. So there's been a significant increase in focus from the federal government to crack down on fraud, waste, and abuse in the healthcare space. And we are seeing an increase in the number of federal criminal cases being brought for healthcare fraud. So many people in their programs are only looking at a state and local criminal check, and we really would recommend federal to be brought into that because a federal case does not get brought at that level. And if you're missing it from the program, you would be unaware of new healthcare fraud related cases. And the second one relates to state and local monitoring. With social media right now, it's becoming more and more clear different organizations the type of monitoring program they're using for their team members and individuals. And what they're sharing now is, hey, if I work for company X, they will only do a background check for you once a year to find the prior year criminal cases. And when an individual is aware of that and knows I committed a crime and I've got 6 months left before my next check, it gives them a very clear window of where they could commit additional fraud, waste, and abuse prior to be getting caught and removed from that program. So having that monitoring program not to be fixed on like an annual check, but to have a continuous monitoring solution. So as crimes are committed, filed with the courts, that organization is made aware of that and then can take the correct actions based on their risk.
Absolutely, Tom. I'm going to add one thing to that. I think, the monitoring component really is key, not just on the criminal monitoring side of things, but thinking about even, historical credentialing processes. Organizations typically credential a provider one time when they onboard them or contract with them, and then they re-credential them 2 or 3 years later. But what we know and what we see is changes in licensure, risk to a patient, adverse actions coming up, board actions coming up, malpractice cases coming up in that 2 or 3 year period. And so monitoring, from a practice perspective, we see that as where the industry is moving and moving aggressively. So it's not enough now to just check a provider and then check them again, especially where there are organizations that can make this data available and more readily available and more actionable early. So I think we're seeing the same thing on the monitoring component that y'all are on the criminal side.
A lot of complexities, a lot of challenges that you guys have addressed. So now I want to talk about how Asurint and Verisys are addressing these challenges together. And that's with the comprehensive provider profile. We'll call it CPP for short. But if I can start with either Amy or Nicole first, can one of you share, exactly what the comprehensive provider profile is and what makes it different from what's currently available in the market?
Sure. So I'll start and then Nicole, feel free to add as well. But ultimately, what we have created is a full true 360-degree view of a provider. So when I mentioned earlier the need to look at a provider not just in their current role and current location, but across the span of their career, we've kind of created a view of a provider that shows all of the licenses that they carry or have carried historically, any adverse actions that individual has had. It includes all of their credentials that allows for a true ongoing view. And then we've integrated this with the criminal component to create not just a holistic view of the provider ongoing and a monitored view of the provider, but also a cost managed way to look at a provider. One of the limitations of organizations historically has been, well, I can't afford to go credential a provider every day. I can't afford to go run a criminal background check in every state and county in the country every day. And so our integrated model has kind of created a view of a provider that allows for these things to connect and inform one another. To Tom's example earlier, right, there's a provider working in Ohio, and we have information around the licensure in Ohio, and we see that there's a criminal or a likely criminal action tied to a new license action. There should be a criminal screening event, right, tied to that. And so we can just be more intelligent about the way that we're managing the processes. And Tom, feel free to add to that, or Nicole as well.
Yeah, I
Yeah, I
think
really
on
like.
the
Go
go
ahead,
ahead,
Tom.
Nicole.
Okay, I liked what Amy said. When Amy was talking about it, I look at it as this is the life cycle of a candidate which becomes an employee. They go through some type of ID verification through the onboarding process, then they have a criminal background check, then you monitor them ongoing for any type of changes. I think what makes the most components peel that back a layer, it's what primary source data and verifications are you doing? Is this real time or as much real time as you can get? And then what does your monitoring look like? We talked a little bit about it today. Is screening once a year enough? Is screening once a quarter enough? Is screening once a month enough? No, we should be doing this in real time. Disciplinary actions, sanctions, exclusions happen daily. So if you are not monitoring ongoing for any type of disciplinary actions, you could be missing things.
Tom,
Yep,
I
and
don't think you
so
want to add
that
anything.
the one of the I think the one of the big pieces relates to the cost effectiveness. So it's a big program. How are we gonna get this started? I'm based out of New York. I can't afford to pay that $95 New York State fee every week, every month, every quarter for every one of my providers. And so that's where, again, pulling the data together between Assurant and Verisys is when we see that potentially adverse event related to the license side in New York, well, that would trigger us. Hey, it makes sense for this one individual to go get that $95 fee and find the associated record. So we're finding 10 times more likelihood of a criminal event on an individual when we see adverse information happen on their, medical board sanctions or on their license itself. So tying those two together really makes it much more understandable, but two, makes it much more cost friendly to take this on. And then the second component to add to that relates to the ongoing view of an individual. So the traditional monitoring aspect is I have a fixed name and a fixed location for someone, and I'm going to look to see if there's new information, new criminal information. But the reality is people are changing their names, they are moving. So this CPP solution is also monitoring that individual to get real-time updates of where do they potentially just move to? Where do they just change their name? And that again pulls back into how we search and how we look for licenses and new state board sanctions.
Absolutely. I think it's amazing how, we're able to bring multiple data points together like this in a more unified, actionable view. I think the idea of how this sort of helps compliance from like a state by state standpoint was addressed, but how else can this combined solution help healthcare organizations stay compliant? Either Amy or Nicole, you want to take this one?
Yeah, I think, we covered it holistically and just being able to look at providers more holistically when they're onboarding. Also from an employee management perspective, I think there's a component there where, once you have this data integrated into your workflows internally, it allows day-to-day decision making to be safer as well. Because ultimately the goal here in healthcare is patient safety, right? So do I schedule a provider or do I not, right? Based on this data. And these changes happening every day versus every couple of years, right? Just limiting that exposure, I think is really critical. And then the other component is, I think, filling in the gaps of you don't know what you don't know. And this is not unique to healthcare. This is in every industry. But in healthcare, an organization may have very good screening processes in place. They may have good credentialing processes in place. But if they're not monitored, they're still not sufficient, right? They're just not. And so I think one of the things that this solution enables is not just that holistic view and that ongoing view that can be integrated into your workflows very seamlessly, but it's not something that you have to build from the ground up. It already exists, right? You can just connect it and you have it. And I think that data accessibility and leaning into what technology has allowed to develop in this space, giving your organization, your enterprise access to this information when you really need to be making decisions about providers and about patient safety. I think that's critical. And so there's an enablement component here outside of just giving you more information. We can enable you to use data to your advantage, right? It's less of what are we keeping out, and also how can we be more intelligent about how we're doing work today, understanding a more holistic view of our providers.
And to add on what Amy's talking about, if you look at it, I want to peel it back a little bit more. It's about educating on the different sources that have the data. So if you look at it, whether it's a criminal background check, whether it's healthcare screening, licensing, credentialing, there's different sources, and each source has a different reporting guideline and timeliness to the data. So we look at it in the healthcare aspect of, does a state report into a federal level? Does it roll up? And then also to be able to get access at a board information level. There's different sources that have different timelines that they report into. And a classic example of that is, say I'm Nicole Berryman, I'm a board certified plastic surgeon. I go out today and I choose to go get a DUI. I got pulled over. When I get pulled over, since I'm board certified, the first thing that happens is I go before a board and those meeting minutes are taken. Well, then from there, it's a legal process. Do I plead guilty? Do I go through a trial? Do I fight it? That's a lengthy process from the time that I got my DUI to the time that I go through a trial process to then does it turn into a conviction to where you can make a higher fire decision. So again, it goes from the board level down to a state level, down to a federal level, and that's that gap right there can span 6 months, 9 months, 12 months. So you want to make sure that from a source level that you're pulling in as many sources, kind of what Tom was talking about. You don't want to just run a county. You might want to look at adding a state or federal as well.
And I think that's where the expertise in such a complicated system comes in on this product is you don't have to come to us to say, here are the 160 things I'd like you to do as part of your check. It's we understand how the data flows between different counties and states and at the federal level to actually provide that to you. And again, as you're monitoring an individual, we are the ones that are tracking what's going on through lessons learned of monitoring millions and millions of providers, again, to auto adjust and update what we're looking for to give you actionable information.
And there's actually a pretty interesting story with how the comprehensive provider profile has helped the Centers for Medicare and Medicaid Services. Tom, I'll go to you first, but can you share how the CPP has helped CMS just protect vital programs to reduce fraud, waste, and abuse?
Yeah, so we have been supporting federal program now for over 3 years, providing both the criminal and over the last just about 2 years now with Verisys together to bring these two together to again drive more actionable insights for that federal program. And we see as again, this is across the United States, and there are over 6 million people in this program. So this has to be something that is good enough to handle just one state, but flexible enough to handle all 50 states. So from a national screening perspective, we have gotten significant insights to jurisdictional trends, regional trends, and over the years. So Nicole was sharing about what happened in COVID. There was a huge change in activity from these individuals, post-COVID versus pre-COVID. Part of that is telehealth. Where are they providing this? But more importantly, were they then committing crimes as a result of that? And so we've seen a substantive change as a result of that. So the federal level has been significant for us to again support the prevention of fraud, waste, and abuse. But the second is the continuous learning on new trends of what providers are doing from the bad actor standpoint. Again, and improving that model that so it can be the idea of this can be applied throughout all 50 states.
Amy, Nicole, do you have anything to add to that?
Yeah,
No.
I was gonna say what I like with this is that you take the CMS model, which has proven out very successful. In my mind, I sit there and think, okay, if there's a program that was so successful, where else can I replicate this? Can I replicate it? Because if you look at the CMS program, that's something that's federal, it's the Medicare level. Can this then be related and replicated down to a Medicaid level, down to a state level? If something is that successful, you can take that model, replicate it and roll it out to like a Medicaid or a state level, or even across other organizations. So again, back to the payer space, the provider space, the pharmacy space. How can we help eliminate fraud, waste, and abuse with doing the ID verification, with doing the credentialing, with doing the background checks, with doing the monitoring?
Fantastic. Really what an amazing thing Asurint and Verisys have built together here. On a final note, I guess, what is next for CPP? Is there anything additional you want to share, kind of where the solution could potentially go?
I think Nicole covered this nicely. I think that looking at the provider holistically, this is where healthcare is going. Monitor, 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 right? That's going to continue. And so I think, where we're looking with, CPP is ultimately, areas where we can help enable enterprises to leverage that information sooner in their processes, faster in their response times, more integrated into their workflows. That it's really just access, right? It's we have the data, we have the connections, we have the workflows. It's how do we now empower and enable like enterprises, government organizations, et cetera, to leverage that and to use our expertise and our learnings from the industry to help guide that. Where do we see the most value? Where do we see organizations preventing the most risk? Where do we see patient risk being meaningfully reduced? When this data is available at certain points in a day-to-day process. So I think that's where we're focused from a Verisys perspective, but Tom obviously would welcome your perspective on this as well.
Yeah, I agree. It's the idea of real-time information, and what we have today provides a very strong picture of that. But we know individuals change, where they, for my side, where are they committing crimes, what is happening. That will require us to also continually to adjust where we search products and services we pull into this. But the idea being that there is a foundation within CPP to continue to add new components to it, again, to make that view even more robust and to expand upon, again, not just individuals in just specific jurisdictions, but truly a nationwide product.
Amazing. This has been a really great discussion, everyone. Thank you, Amy, Nicole, Tom, all you for sharing your expertise and perspectives today. And for those listening, if you'd like to learn more about how Asurint and Verisys are partnering together, you can either visit Asurint at asurint.com or Verisys at verisys.com. Thanks for tuning in to today's Partner Perspectives, and we hope to see you on the next one. Take care.